Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previously related question answer. Part 8. Let's start. The first question. In ECG interpretation, the P wave represents option A. Ventricular depolarization, option B. Atrial depolarization, option C. Ventricular repolarization, option D. Atrial repolarization. The correct option is option B, atrial depolarization. The antidote for magnesium sulfate toxicity is option A, protamine sulfate, option B, vitamin K, option C, calcium gluconate, option D, naloxone. The correct option is option C, calcium gluconate. The dark blue discoloration of the vaginal mucous membrane during pregnancy is called option A. Hager's sign, option B. Chadwick's sign, option C. Goodell's sign, option D. Ladin's sign. The correct option is option B. Chadwick's sign. The most common cause of postpartum hemorrhage (PPH) is option A. Retained placenta, option B. Cervical laceration, option C. Atonic uterus, option D. Coagulation defects. The correct option is option C. Atonic uterus. The calculation of pediatric dosage based on the child's weight is known as option A. Young's rule, option B. Clark's rule, option C. Freud's rule, option D. Parkland formula. The correct option is option B. Clark's rule. While administering heparin subcutaneously, the nurse should avoid option A. Checking the PTT, option B. Using a 25 gauge needle, option C. Aspirating or massaging the site, option D. Rotating sites. The correct option is option C. Aspirating or massaging the site. What is the color coding for a nitrous oxide cylinder? Option A. Black with white shoulder, option B. Blue, option C. Black, option D. French blue. The correct option is option D. French blue. A patient is admitted with suspected deep vein thrombosis (DVT). Which of the following clinical signs is considered a classic, though sometimes unreliable indicator? Option A. Kerning sign, option B. Brudzinski sign, option C. Homan sign, option D. Cullen sign. The correct option is option C. Homan sign. According to Triage, in a disaster situation, a patient with a sucking chest wound should be assigned which color tag? Option A. Green, option B. Yellow, option C. Red, option D. Black. The correct option is option C. Red. A patient arrives at the ER with 27% total body surface area burns. According to the Parkland formula, how much fluid should be administered in the first 8 hours? Option A. 1/4 of the total 24-hour volume. Option B. Half of the total 24-hour volume. Option C. The entire calculated 24-hour volume. Option D. 1000 ml per hour. The correct option is option B. Half of the total 24-hour volume. A patient with chronic obstructive pulmonary disease (COPD) is on oxygen therapy. What is the recommended flow rate? Option A. 1 to 2 liter per minute. Option B. 5 to 6 liter per minute. Option C. 10 to 12 liter per minute. Option D. Venturi mask at 60%. The correct option is option A. 1 to 2 liter per minute. Which vaccine is contraindicated during pregnancy? Option A. Tetanus. Option B. Influenza injected. Option C. MMR, measles, mumps, rubella. Option D. Hepatitis B. The correct option is option C. MMR, measles, mumps, rubella. The first sign of puberty in girls is typically option A, menarche, option B, puberty, option C, thelarche, option D, growth spurt. The correct option is option C, thelarche. At what dilation is the active phase of the first stage of labor typically considered to begin based on recent guidelines? Option A 4 cm, option B 2 cm, option C 10 cm, option D 6 cm. The correct option is option D 6 cm. A patient is diagnosed with right side heart failure. Which assessment finding would the nurse expect? Option A, jugular venous distension, JVD. Option B, crackles in the lungs. Option C, dyspnea on exertion. Option D, orthopnea. The correct option is option A, jugular venous distension, JVD. What is the primary action of the drug magnesium sulfate when used in a patient with preeclampsia? Option A, to prevent seizures. Option B, to increase urine output. Option C, to induce labor. Option D, to low blood pressure. The correct option is option A, to prevent seizures. A 32-week pregnant woman presents with painless bright red vaginal bleeding. Which condition should the nurse suspect? Option A, preterm labor. Option B, vasa previa. Option C, abruptio placenta. Option D, placenta previa. The correct option is option D, placenta previa. The physician orders 500 ml of normal saline to be infused over 4 hours. The drop factor is 15 GTT per ml. What is the flow rate in drops per minute, GTT per minute? Option A, 21 GTT per minute. Option B, 31 GTT per minute. Option C, 42 GTT per minute. Option D, 60 GTT per minute. The correct option is option B, 31 GTT per minute. An 8-year-old child is diagnosed with nephrotic syndrome. Which clinical finding should the nurse expect? Option A, hypolipidemia. Option B, massive proteinuria and generalized edema. Option C, gross hematuria. Option D, severe hypertension. The correct option is option B, massive proteinuria and generalized edema. Which electrolyte imbalance is a patient with nasogastric suctioning most at risk for? Option A, metabolic acidosis. Option B, hyponatremia. Option C, hypokalemia and metabolic alkalosis. Option D, hyperkalemia. The correct option is option C, hypokalemia and metabolic acidosis. Thank you for watching. Please like and subscribe.